Have you ever paused to consider what's truly shaping our health across the entire globe? It's not just a checklist of diseases, it's about digging deeper into the powerful forces that drive these conditions, and more importantly, discovering the actionable steps we can take to improve our well-being. As we face the rising challenges of polypharmacy, where someone is prescribed 5 or more medications, adverse drug reactions, and soaring healthcare costs, it becomes crucial to explore a different approach. Enter lifestyle medicine, a revolutionary approach that focuses on evidence-based interventions like nutrition, physical activity, stress management, and building social connections. This exciting field offers a beacon of hope for those seeking to achieve disease remission and to lessen their reliance on pharmaceuticals. In this video, I'll dive into specific medical conditions where lifestyle changes have led to a remarkable decrease in medication use. Get ready for detailed summaries of key studies and their enlightening implications. First, let's start with the global impact of chronic disease. Have you heard of the Global Burden of Disease study? This extensive worldwide research initiative quantifies health loss from diseases, injuries, and risk factors, guiding health policies and priorities. One of the metrics it uses is DALYs, or disability-adjusted life years, which represents 1 year of healthy life loss due to illness, disability, or premature death. Another important measure is HALY, Health-Adjusted Life Expectancy, which indicates how many years a person can expect to live in full health, unburdened by illness or injury. You may also come across the concept of healthspan, which focuses on living not just longer, but better. According to the GBD study, chronic non-communicable diseases, or NCDs, accounted for a staggering 1.75 billion DALYs in 2021, up from 1.47 billion in 10 years. While some of this increase can be attributed to an aging population, it's alarming to see age-standardized rates of mental health and diabetes on the rise. Anxiety increased by 16.7%, depressive disorders by 16.4%, and diabetes by 14%. With these significant shifts in global health, the urgency for prioritizing NCD prevention and treatment policies has never been clearer. We must transition from a reactive sick care system to a proactive approach that strengthens our healthcare. Now let's embark on an exploration of the emerging field of lifestyle medicine, a compelling, evidence-based approach not just to prevent disease, but to reverse and reduce the global burden of disease and disability. At its core, lifestyle medicine is a discipline that rigorously studies how our daily habits and practices profoundly impact prevention and treatment of disease, often working hand in hand with conventional therapies in mainstream medicine to get to the root causes of illness as opposed to just managing symptoms. The data is compelling. Over 80% of chronic conditions could be prevented with healthy lifestyle interventions. And here's the evidence that it works. A 2013 study of 23,000 participants who followed 4 health habits that included not smoking, 30 minutes of moderate exercise 5 times a week, having a BMI under 30, and eating a healthy diet saw a 78% reduction in risk of developing any chronic condition over 8 years. In addition, there was a 92% reduced risk of developing diabetes, 81% less risk of a heart attack, and a 36% reduction in cancer risk. A groundbreaking study published in the New England Journal of Medicine highlighted the powerful impact of intensive lifestyle modifications in preventing or delaying type 2 diabetes. This research targeted non-diabetic individuals at high risk due to elevated glucose levels, comparing a lifestyle intervention program to metformin treatment in a placebo group. The results were striking. Both the lifestyle changes and metformin significantly lowered diabetes incidence, but the lifestyle intervention was far more effective, cutting the risk by 58% compared to 31% reduction with metformin. The program encouraged participants to achieve at least a 7% weight loss and engage in 150 minutes of moderate exercise weekly. While the primary focus was prevention, the study carries significant implications for reducing medication use. By showcasing that lifestyle changes can avert the onset of type 2 diabetes, it suggests that such interventions may reduce or eliminate the need for future diabetes medications, helping to avoid unnecessary medications and their associated risks and costs. And what about those who have already developed type 2 diabetes? Several trials have shown that remission and reversal is possible through intensive lifestyle interventions. You can learn more about this in another video. It's not just diabetes. Hypertension or high blood pressure is more common than you might think, and it can lead to serious health issues like heart disease, stroke, and kidney problems. While managing this condition often involves a mix of lifestyle changes and medications, exciting research shows that sometimes changing our daily habits can be powerful enough to lower blood pressure, so much so that we can cut back or even stop taking medications altogether. One notable study published in the American Journal of Hypertension looked at how intensive lifestyle changes can affect the need for medication in people with mildly elevated blood pressure. The findings were eye-opening. They showed that these lifestyle tweaks can significantly reduce the number of people needing antihypertensive medications according to the established guidelines set by the American College of Cardiology and Heart Association. Participants who embraced lifestyle changes, like following the DASH diet, which emphasizes fruits, veggies, and whole grains, and focusing on weight management, saw their blood pressure drop below the levels that would usually trigger a prescription. Additionally, the trial of non-pharmacological interventions in the elderly, or TONE trial, which took a deep dive into the effectiveness of non-drug approaches for managing hypertension in older adults, was a landmark study that involved 975 participants aged 60 to 80 who were already on antihypertensive medications. They explored whether strategies like cutting back on sodium and losing weight could help reduce or even eliminate their need for medication. After 90 days, participants tried to stop their blood pressure meds, and the results were fantastic. Most of those who made lifestyle changes managed to keep their blood pressure at healthy levels without needing medication. In fact, the success rates for stopping medication were impressive, around 92.6% for those only reducing sodium, 93.2% for those only focusing on weight loss, and the same for those combining both strategies, higher than the 86% success rate in the usual treatment group. The TONE trial clearly showed that lifestyle interventions can lead to safe reduction or discontinuation of antihypertensive medications in older adults with controlled hypertension. This powerful evidence highlights how effective non-drug strategies can be in managing chronic conditions like high blood pressure. A follow-up study of these patients revealed that those who were most likely to be successful at stopping antihypertensive meds were those that followed lifestyle changes that led to weight loss and reduced sodium intake. In fact, over 80% of these patients can remain off medications for more than a year. Next, let's explore mental illness, especially severe ones like schizophrenia, which often require long-term medication. These medications can come with significant side effects, including metabolic changes. Recent research shows that lifestyle changes may help improve overall health and even reduce the reliance on these medications. One study published in the Frontiers in Psychiatry, called the Multi-Study 3, looked at how a comprehensive lifestyle program could affect medication use in inpatients with severe mental illness. The program aimed to enhance overall health through various lifestyle changes. Within the lifestyle intervention group, the median daily dose of psychotropic medication fell from 3.74 to 0.79 over 18 months. Additionally, the number of patients using psychotropic medication dropped from 100% at the start of the study to 75% at the follow-up in this group. Participants experienced not only reduced medication dosages, but also other health improvements after the 18-month program. While more controlled studies are needed to confirm these results, This research offers promising evidence that lifestyle changes can help lower the need for psychotropic medications in individuals with severe mental illness. So how can you achieve these results? Lifestyle medicine breaks it down into 6 core pillars: physical activity, proper nutrition, stress reduction, avoiding toxic substances, sleep optimization, and social connections. So let's unpack each of these and see how they can play out in preventing and maybe even reversing disease. Starting with nutrition. The core recommendation involves a shift towards a whole food plant-based diet. These are inherently anti-inflammatory and profoundly benefit cardiovascular disease, cancers, obesity, and diabetes. In a group of longitudinal studies, swapping just 5% of daily calories from animal protein to plant protein was linked to a 23% reduction in diabetes risk. And specifically in Asian populations, high consumption of fermented soy consumed in traditional Chinese diets reduced the risk of diabetes. So why not try adding some tofu to your vegetable or meat stir-fry? Or keep some frozen edamame in your fridge for a healthy snack. On the other hand, 50 grams of processed meat per day, that's 2 slices of ham or bacon, or 1 smoked sausage or hot dog, increase diabetes risk by 15%. How do these diets compare to standard medical care for type 2 diabetes? A pilot study comparing a whole food plant-based diet with moderate exercise to standard care using medications suggested the lifestyle medicine intervention was more effective at reducing baseline glucose and HbA1c by 1.6%. This occurred as early as 2 weeks, even before weight loss, suggesting that diet quality and physical activity played a role. And in another study involving intensive lifestyle strategies, 93% of participants reduced medications within 7 days. Next, physical activity. It is multifaceted in its effect on reducing cardiovascular disease, type 2 diabetes, obesity, and several types of cancers. A bonus is that it significantly improves brain health, and it's a powerful tool against anxiety and depression. As a part of my lifestyle medicine practice, I record physical activity as a vital sign during the clinical evaluation, just like I check blood pressure and waist circumference. Personal anecdote: when it comes to combating perimenopausal brain fog, regular daily movement in as little as a few days improved my focus and concentration. In contrast, being sedentary for a week significantly worsened my brain fog. Unfortunately, less than 40% of physicians counsel patients on getting more active. There are systemic barriers for physicians to prescribe a walk versus a pill. Time constraints, lack of adequate reimbursement for counseling, and lack of training in behavioral change skills. This is changing, and it's encouraging to learn from research that physicians who engage in healthy eating and physical activity are more likely to counsel their patients about making lifestyle changes. The era of the physician coach is here. Next, stress management and building resilience. Studies show that chronic decompensated stress is associated with systemic inflammation and accelerates the shortening of telomeres, the protective caps on our DNA, which is linked to aging and cancer risk. Stress impacts more than just our emotions. What helps to shield and protect us, not just mentally, but at the fundamental biological level, involve strong social connections. Studies show that breast cancer survivors who are well integrated socially have lower recurrence and better disease-free survival. Social connectedness is also associated with lower risk of early death, better blood sugar control, reduced risk of high blood pressure and diabetes. The quality of your friendships, not just the number, provides the greatest health gains. Even in elderly people, social ties lower dementia risk by 70%. One study showed that the lack of social connection is a greater detriment to health than obesity, smoking, and high blood pressure. But did you know that the power of patient-driven behavioral change with dietitian-led sustainable steps to improve nutrition can lead to a tapering of antidepressants? Check out the SMILE study for this. Now let's talk about sleep optimizations, since we are amid a sleep deprivation epidemic, with 1 in 3 people being chronically sleep deprived. We are sleeping 1 to 2 hours less per night compared with 60 years ago. The brain's waste clearing system, called the glymphatic system, is most active at night during deep sleep. Glymphatic dysfunction has been linked to cognitive impairment and dementia. On the flip side, consistently good sleep dramatically improves energy, memory, stress resilience, food choices, learning, immune function, and significantly reduces the risk of type 2 diabetes and Alzheimer's. Here's a weight loss tip that's drug-free. Several studies show that people with insufficient sleep consumed an average of 500 calories more the next day versus those who slept 8 to 9 hours. Turns out that ghrelin, our hunger hormone, is revved up, and leptin, our satiety hormone, is turned down with sleep deprivation. Sleep deprivation also activates our reward-driving pathways. These evil twins makes high-calorie foods appealing, and we are surrounded by them. So if you're trying to keep a healthy weight, especially during perimenopause, prioritize your sleep or get some help to improve it. Next up is the pillar of avoiding smoking that cannot be missed. The evidence is overwhelming. It increases the risk of stroke, heart disease, and countless other health problems, including cancers. Once you stop, the health improvements are almost immediate. Finally, and not least important, is the pillar of social prescribing. This is where healthcare professionals refer to non-clinical local community services, things that address the social, economic, and environmental factors that impact on health. For example, debt advice, housing support, community groups, and volunteering. There's promising evidence that this can reduce urgent hospital admissions by up to 70% and A&E visits by 17% in some studies. All this evidence, why isn't lifestyle medicine more widely adopted? There are several reasons for this, and one of the main barriers is time constraints. A standard 10-minute, and even in some countries, 3 minutes isn't enough time to cover all these areas. Lack of physician training, provider fears that coaching won't work, and low reimbursement rates for lifestyle counseling are substantial challenges. The answer to bridging this gap and shifting the healthcare paradigm may lie in dedicated lifestyle medicine clinics with a multidisciplinary team of accredited providers that can empower both clinicians and patients. It needs a concerted effort, not just the doctor, but also dietitians, exercise physiologists, psychologists, health coaches, and more, all working together to provide that holistic, tailored support. Crucially, training our healthcare professionals from globally recognized programs provided by the American, Australasian, British, and locally the Chinese lifestyle medicine societies are legitimate avenues for robust training and accreditation. What goes hand in hand with these improvements is active deprescribing by your doctor. Medication deprescribing is a supervised dose reduction or discontinuation of medications that are no longer needed due to improved health from lifestyle changes. This not only reduces medication costs, but also empowers patients. But remember, never stop your medications without the supervision of your doctor. What about time constraints and provider fatigue? That's where shared medical appointments, or SMAs, shine as a cost-effective and scalable way to improve lifestyle medicine programs. The Complete Health Improvement Program has over 30 peer-reviewed publications that shows how group-based programs improves blood pressure, glucose, and weight. These are structured lifestyle medicine interventions for adults, delivered in groups of 10 to 15, and includes education, health screening, and facilitated discussions to enhance motivation and adherence to lifestyle changes. It's not just impactful to patients. There's evidence from physician feedback, me included, that this approach is transformative, inspiring, rejuvenating, and even fun. Actionable evidence-based models do exist, and we should implement them more widely. So let's work together to create health, not just reacting to illness for the well-being of our future generations. In summary, the global burden of disease is shifting towards NCDs, mostly lifestyle-related, and pose significant growing threats to future generations. There is an urgent need for actionable, profound, and evidence-based lifestyle medicine solutions for individuals and communities. Let's prepare ourselves and be a part of this solution together. Knowledge is most powerful when crucially applied. Those daily habits are within reach. Help spread this hopeful and powerful message by sharing it with people you care about and anyone who needs to know. What small conscious steps will you take this week to reclaim your health? Leave your comments below, and I'll see you next time.